Chairman Sanders Miller, thank you. And let me at this time ask unanimous consent to enter into the record Senator Johan's comments. He's sick today and can't attend.
Without objection.
I thank the chair. Let me say to my colleagues, we owe everything to our nation's vets. Everything. We owe everything that they need to be provided. We're all aware that there's widespread systematic failures that plague the Department of Veterans Affairs healthcare system. The culture that has developed at the VA and the lack of management accountability is simply reprehensible. It's becoming increasingly obvious that a cultural problem has taken deep root in VA, and simply increasing funding will not solve it. In fact, it could prove to only reinforce that culture. Reforms are desperately needed within VA, and some of these changes can't be fixed through legislation. They must come from within VA. But addressing the cultural problems within VA won't provide relief for the roughly 100,000 veterans experiencing long waits across our nation today. It's now time for us, in partnership with the VA, to begin to repair the damage that has resulted from systematic failures that have undermined the trust veterans have always placed in the Veterans Administration. To begin to change the culture at VA, there are several reforms we must pursue to ensure veterans have access to timely, quality health care. Now, the start of an effective Congress and a conference comes with accurate numbers. And since Ranking Member Michaud mentioned CBO, let me talk numbers for just a minute. VA is basically broken down in two sides, the Veterans Benefit Administration and the Veterans Health Administration. Last year, this Congress for this year appropriated $55 billion for VHA, the Veterans Health Administration. Of that $55 billion, most members would be shocked to know that 48% goes to direct patient care. We're talking about $27 billion of appropriated money goes to the delivery of health care to our nation's veterans. 52% goes to administration and other programs that emanate out of the VHA budget. Of that $27 billion, that's doctors and nurses. It's the delivery of care to all of our 8.4 million veterans who CBO has scored enrolled and active. Now, it brings us to the House bill and the Senate bill. The House bill was scored at $35 billion a year. And if fully implemented after the two-year period, scored at $50 billion. The House bill was scored at $44 billion. Basic difference of timing on the wait times from 14 days to 30 days. Now, I asked my colleagues around this table, is the CBO product that they've produced reflective of anything sane? That the scoring of a bill that offers limited choice if one of two things is triggered in the House side, and that's we've either gone past the 30 days established by the VA, or they live outside of 40 miles from any VA facility, be it clinic, outpatient facility, or medical major facility, that it would exceed by $7 billion on an annual basis what we spend for the entire delivery system for our nation's veterans. To my colleagues, this is ludicrous. This is impossible for us to even start an intelligent discussion on what we put in legislation when we've got numbers that are this so grotesquely out of line. Let me give you a few more references to this if I can. VA estimated that of the 8 million veterans eligible for VA but not enrolled, that if we pass this legislation, they would automatically drop whatever coverage they have today, be it Medicare, TRICARE, private insurance, FEHBP for many who are federal employees, and that when they dropped that, they would immediately go into the VA system for 2 years. I want to ask you to stop and think about that for just a second. To a veteran on Medicare, they're going to drop their Medicare, go into the VA for 2 years, and then pay the penalty to get back into Part B Medicare? For an employee who has private insurance, they're going to drop their insurance and leave their spouse uncovered because they see some advantage to being on VA? It's estimated that 90% of those veterans who are eligible but not enrolled in VA have less than 50% disability rating. The threshold to where it's VA care comes without a copay. These are individuals who have already made a determination that the coverage that they're under is the best coverage they could have. If not, they would be enrolled in the VA today. So the fact that CBO now says with just the execution of this minor reform legislation, it would trigger 8 million people into the system that don't exist today but are enrolled, again, is just as ludicrous as the $35 or $44 billion price tag that CBO has put on the bill. CBO determined, as you would imagine, that only 3% of their cost is attributed to the 40-mile trigger that we put in the Senate legislation. In other words, there are very few veterans around the country that live more than 40 miles from a VA facility. But like I've heard some of my colleagues say, when you've got something that makes as much common sense as this, that it's less expensive to let them get local care than it is to pay their reimbursement to a VA facility, can't we accommodate the veteran's wants, his needs, and the taxpayer's fiduciary responsibility to come out cheaper by doing it? And this is the only place within the CBO score that they actually agreed that the impact is minimal from a standpoint of the number of people that are affected. So it leaves one thing. How could CBO come to the conclusion that the VA was at a point where it couldn't add any more enrollees without a massive increase in providers? In other words, the VA's full. Don't knock. Don't come. Well, let me suggest to you that the VA, just on one matrix, and that's primary care panels, sees 1,200 patients, when non-VA providers see 2,500 patients. The VA sees 1,200 patients on a primary care panel when the non-VA providers see 2,500 patients. When we talk about systemic problems, when we talk about cultural changes, this is not targeted at folks that veterans don't see every day. It's targeted at providers that, for whatever reasons, within the VA, don't conduct themselves at the same rate that non-VA providers, in fact, experience. So I say to my colleagues, I hope that the chairman and the ranking members will challenge CBO on the score. To start this process, we need to know exactly what it is that happens when we begin to move the dials one way or the other, and to start at the point we have started because of that score is, in fact, more challenging than anything I could ever think of. I thank the patience of the chairman.
Congressman Lamborn.